Especially young doctors were getting into this profession. Some got into the profession because of the passion they have for what they do, others because they want to save lives, others because of personal experiences, either personally or through their family members. But they're now beginning to regret why they decided to do medicine only because of COVID-19 and how the government has been treating medics in the country. They feel neglected. They feel not taken care of by the same government that is supposed to take care of every Kenyan, including our medical, professionals, the doctors, the nurses, the clinical officers. The list is endless. The country has lost several nurses and doctors during this time of COVID-19. So far, we know that it is day 5 of the nurses and clinical officers strike. Doctors have suspended their strike. But after 9 days from today, if the government does not do anything, the same doctors who call for the strike will decide to go back. Actually, they've said they will go back. They'll decide they will actually kick off their strike officially until the government heeds to their demands. So now, this morning, I'm privileged to have Dr. Gorgudi, the Central Kenya Medical Practitioners, Pharmacists and Dentist Union Secretary right there in the Central Region. And Daktari, thank you so much for joining us here on KTN this morning. We also expect the presence of the Kenya National Union of Nurses Secretary General Seth Panyako. Once he joins us, we'll also include him in this conversation. But let's have this conversation first with Dr. Gorgudi. Daktari, thank you so much for joining us here on KTN News Center. So it's just 9 days remaining before doctors officially go on strike. Do you have hope that despite the fact that the National Assembly Health Committee and the Senate Health Committee have decided to be the go-in between you and the government, this strike will not happen? Probably the government will decide to heed to your demands?
Thank you so much for having me today, Brenda. We are quite hopeful that the Parliamentary Health Committee and the Senate Health Committee will be a great mediator. Yesterday, we made quite some stride in our discussions, and we talked about the NHIF and the doctors on contract and even the unemployed doctors. But I'd like to bring one thing to your attention. This mistreatment of doctors did not start with COVID-19. COVID-19 just exposed the underbelly of the government. We've been going on strikes for so long for the same things. Even when you look at our strike notice now, it's the same things that we are asking for. And it's so unfortunate that the response we are getting from the government is quite insensitive. You can see that even after the Dr. Stephen Mugusu passed on, you heard the cabinet secretary saying that doctors are careless and that they should be more careful. But it's not that we are careless. We do not have personal protective equipments. We do not have medical insurance. We are providing a service that we cannot afford ourselves. We have people who are dedicating their entire lives to the study of medicine, and then you're frustrated. And why are you frustrated? Because you're asking for better health care, not for yourself, but for Kenyans. When doctors and other health workers go on the street to demonstrate, they are demonstrating for the public. Doctor-patient relationship is symbiotic.
All right. So, Daktari, when you say you do not have PPEs, is it that it is not enough, or is it that it is there? It is the quality of the PPEs that are not good?
They are not enough, and the quality is also not good. It's both. Sometimes when they release the substandard quality, and when they don't have it at all. So it's a catch-22. There is no better option. We want standardized, proper PPEs. We cannot afford to lose health workers anymore.
All right, so let me bring in a comparison here, Daktari, because it looks like most of the doctors who are complaining are doctors working in the public health facilities. When I look at doctors working in the private health facilities, they're not really complaining. Probably they have their own challenges, but they're not talking about it. Is it that the government is not caring for doctors working in public hospitals, unlike those working in the private facilities?
I can't speak much for the private facilities, but I think in the private hospitals, because of the litigations and things like that, they take proper care of their healthcare workers. But I would still believe that even in the private sector, we do not have enough PPEs. They're just probably not speaking up. But in the public sector, for sure, we are lacking PPEs, and whenever we get them, they're substandard. You're given one surgical mask that is supposed to be effective for 3 hours. You're given that mask to wear the entire day, and you're given 5 masks on Monday. You use them from Monday to Friday. Ikiharibika, if it gets soiled or you don't have it, that's on you. You buy your own mask. So we are feeling like we are not well protected, and we are just been left alone.
All right. And so county governments have had the argument of that the latest case, it's sad that we lost Dr. Stephen Mogusu, but let me use that as an example. And Machakos County Governor was saying that this is a doctor who was seconded to the referral hospital in Machakos, and so his payment and, the whole welfare of this doctor was supposed to be done by the national government and not the county government. So who is failing the doctors? Is it the national government or the county government, or is it both national and county governments?
I think it's the national and the county government. And then about seconded officers, even if you've been seconded from the national government to the county government, you are an employee of the county government. The county is supposed to take care of you. That is what's supposed to happen. We have lost a doctor. We have lost a resource. We cannot be fighting about who should have taken care of that doctor. We already have these policies in place. The only problem is implementation of these things. And that is the biggest problem. So I feel like both the national government and the county government are just trying to point fingers at each other, blame game, taking us round in circles. There are policies to this effect. They should just implement them so that all health workers can get what they deserve.
All right, and a section of Kenyans might be wondering, so doctors are complaining about lack of health insurance, they're complaining about lack of enough PPEs, but remember on the 20th of April this year, the president gave a directive that doctors need to be given that risk allowance. Have the doctors received any sort of financial support from the government after the president gave that directive?
Indeed, we did get the COVID allowance, but it was only for 3 months. And it was from 20,000 to 5,000 shillings, depending on the cadre that you are in. But after the 3 months, COVID did not finish. In fact, now we're in the second wave. And so we are asking for an enhanced risk allowance because COVID is here with us and will be in the front lines until this thing is gone. So that's why we are asking for an enhanced risk allowance, not a COVID allowance, because COVID has become a part of our livelihoods now.
Daktari, are you telling us it was just for a specific period, 3 months only?
Yes, only 3 months.
So after 3 months, the government has not given any risk allowance to doctors?
We still get a risk allowance. We don't get the COVID allowance.
You don't get the COVID allowance?
Yes.
So let me just read some of the union officials' demands. You're one of the union officials, and this is what they say, that the unions have cited a combination of inequalities in public hospitals, including poor facilities, staffing, insufficient protective working equipment, lack of a comprehensive medical insurance. This is something that doctors have always talked about, medical insurance, which has contributed to an extremely difficult and draining, hazardous and injurious working environment. Some of the referral hospitals at the counties, as we speak, Daktari, you can agree with me or you can correct me if I'm wrong, don't even have enough equipment when it comes to handling COVID-19 patients. So how are doctors working under these circumstances, difficult circumstances during COVID-19?
I'd like to bring your attention to some of the leaked messages from Dr. Mugusu. And he said that the isolation center that they are working in, there are only 5 doctors serving 16 patients. So that shows you how, and they work day and night, only 5 doctors, 16 patients that need 24-hour care. Sometimes the oxygen used to run out from the tank. So you've taken care of this patient for 5-10 days, and then one day they die because there is no oxygen. And we've been talking about getting piped oxygen, but we are still having tanked oxygen and the aerosolized oxygen, where these prongs, when you go to the hospitals, you get patients who have prongs in their noses, and there is a machine over there, an oxygen concentrator. It aerosolizes the virus, which is even dangerous. So we don't have enough isolation centers. We do not have enough beds, and we do not have COVID ICU. We keep talking about 200 ICU beds, but those are just ICU beds, and they are always occupied. We do not have COVID ICUs. We do not have proper isolation centers. We do not have proper equipment in those isolation centers. We don't have specialists like anesthesiologists who are supposed to head ICUs, because the counties have refused to take doctors for postgraduate training, and now the shortage is biting. They are not employing enough medical officers or nurses or COs or any other health worker. So whoever is employed with that little salary that you get, because they are given a consolidated salary as they are on contract, these doctors, and as we speak they have not been paid in 5 months. We are working under a lot of duress. We are demotivated, and we are scared for our lives. We are not getting paid for the work we do. We are not given enough equipment to take care of our patients or ourselves, and we are broke, and we cannot even afford the services we are giving. It's desperate.
Dr. you've painted such a grim picture of what the doctors are going through during this time of COVID-19. Allow me to take a short break, but when we come back, my colleague Emmanuel too is at the Central Business District.